Hematology, leukocytes. What is the reference range for white blood cells? Normal range for WBCs is 4 to 11 times 10 to the 9 per liter. Name the 5 WBCs in order of highest to lowest concentration. Neutrophil, lymphocyte, monocyte, eosinophil, basophil. Neutrophil. What is the function of the neutrophil? The neutrophil is first to diapedese and reach tissues in response to antigenic stimulation. Define antigenic stimulation. Antigenic stimulation is the reaction to chemotactic factors such as complement, opsonins, bacterial products, injured tissue, and hemostatic components. What is involved in neutrophilic phagocytosis? Neutrophilic phagocytosis is the attachment of a neutrophil to a foreign object and the formation of a vacuole around it, and then the release of lytic enzymes through degranulation. What are 4 morphologic indications of pathologic neutrophilia? Pathologic neutrophilia will present 1. A shift to the left, 2. Dull bodies, 3. Toxic granulation, and 4. Toxic vacuolation. What are the 4 inherited morphologic abnormalities of the neutrophil? These are Chédiak-Higashi, Pelger-Huët, May-Hegglin, and Alder-Reilly. Which disorder involves the abnormal fusion of the primary and secondary granules, forming large gray-green granules that are unable to degranulate? Chédiak-Higashi, also associated with photophobia and skin hypopigmentation. Which disorder involves hyposegmentating of the nucleus, forming a characteristic pince-nez shape? Pelger-Huët. What is the cytoplasmic anomaly characterized by May-Hegglin disease? May-Hegglin is characterized by large, crystalline, Döhle-like inclusions appearing gray-blue and spindle-shaped, also associated with giant platelets and thrombocytopenia. What is the cytoplasmic anomaly characterized by Alder-Reilly disease? Alder-Reilly is characterized by large eosinophilic granules, which can be confused with toxic granulation. Lymphocyte. What are 3 types of lymphocyte? T cell, B cell, and NK natural killer cell. What is another name for T cell, and what is its function? The T cell provides cellular immunity, representing 80% of lymphocytes in the blood. The T cell is dependent of antigenic stimulation and when activated will produce cytokines, interleukins, and lymphokines. What are the 3 types of T cells? The 3 types of T cells are 1. T helper cell, 2. T suppressor cell, and 3. Cytotoxic T cell. What is the function and CD marker of the T helper cell? T helper cells have the CD4 marker and activate B cells. What is the function and CD marker of the T suppressor cell? T suppressor cells have the CD8 marker and deactivate B cells. What is the CD marker for cytotoxic T cells, and what are they involved in? Cytotoxic T cells have the CD8 marker and are involved in viral infections and organ rejections. What is another name for B cell, and what is its function? The B lymphocyte provides humoral immunity. What does the B cell become when it comes in contact with foreign antigens? Reactive lymphocyte. What does the reactive lymphocyte transform into, and what is this cell's function? Reactive lymphocytes transform into plasma cells, which produce antibodies. Plasma cells are dominant in the lymph nodes and are not normally seen in circulation. What disease infects the B cell and is caused by the Epstein-Barr virus? Infectious mononucleosis. What is another name for natural killer cell, and what is its function? NK cells are also called large granular lymphocytes, and they destroy tumor cells and cells infected with viruses. What are two CD markers of the NK cell? CD16 and CD56 marker. NK cells are antibody-dependent cytotoxic cells. Explain antibody-dependent cytotoxic cells. This means that NK cells attack antigens that are attached to antibodies such as IgG. Monocyte, eosinophil, basophil. What is the function of the monocyte? The monocyte is highly motile, migrating into tissues to differentiate into macrophages to phagocytize foreign objects. The monocyte also has a major role in initiating and regulating the immune response, processing antigenic information to relay to the T helper cell. What is a cause of monocytosis? Monocytosis can be seen during the recovery stage of an acute bacterial infection and also in tuberculosis and syphilis. Name 3 lipid storage disorders associated with monocytes. Gaucher disease, C-blue histiocytosis, and Niemann-Pick disease. Eosinophil. Describe the morphology of an eosinophil. Eosinophils contain bright red-orange secondary granules, which contain enzymes and proteins. What is the function of the eosinophil? Eosinophils degranulate in response to parasitic infection. Also, eosinophils modulate the allergic response and neutralize the products released by basophils and mast cells. Eosinophilia reflects the functions of the eosinophil to respond to parasitic infections and an increase in basophils and mast cells. Basophil. Describe the morphology of a basophil. Basophils contain large purple-black secondary granules which contain heparin and histamine. What is the function of the basophil? Basophils initiate the immediate hypersensitivity reactions, or the type 1 reaction. Basophilia is a reflection of the hypersensitivity reaction. Malignant disorders of the lymphocyte. In general, what is the difference between leukemia and lymphoma? Leukemia originates in the bone marrow and is initially systemic, whereas lymphoma originates in the lymphoid tissue and is initially localized. What cells are seen in acute leukemia, such as AML and ALL? Acute leukemia involves immature and blast cells, where AML has myeloblasts and ALL has lymphoblasts. What cells are seen in chronic leukemia, such as CML and CLL? Chronic leukemia involves maturing or mature cells, where CML has granulocytes and CLL has lymphocytes.